Hi, good evening. Is Mohammed Mamun Alom, and this is the event we are doing for mental health from Woodbridge Road Pharmacy. And today guest we have Dr. Salma Hasan and our psychologist, and also he's doing pharmacy pre-days as well, James Lacey. So welcome to our event. And the purpose of this event is to help people who is with us around. And if you have any question, you can ask, you can write your question on live here. So we'll go back to Dr. Salma Hasan, and we'll find out how the common mental health patient Dr. Hasan seeing nowadays in her practice. So please welcome Dr. Salma Hasan. Now she will take the floor to talk. Thank you.
Thank you so much for inviting me to today's session. I think this is a very important session because we are going to talk about mental health issues. And I think this is the perfect time to actually talk about mental health issues because of the pandemic we are going through at the moment. To answer to your questions that you were asking, what are the common kind of mental health issues we have been seeing as doctors at the moment. The first thing I would say is because of the pandemic, I think there's lots of changes happened to our lives, our personal lives, our social lives, our work environment. Everything has changed drastically over the last few months. So I think there is no guess actually. Because of this, we are seeing lots of patients who are going through really anxious times. So they're very anxious. They're going through very stressful events. So those are the things affecting their lives. So I would say that we are seeing lots of patients who are really anxious and stressed at the moment. And the other thing is that because many of us are actually going through difficult situations in our work as well, so the finances and everything are affecting how we actually act at the moment. So that is also affecting our personal lives. So there are so many conflicts going through our personal life, how we are seeing ourselves as human beings. So those are the things we're seeing at the moment that people are going through. So I don't want to kind of put a tag that they have mental health issues, but this is how our mental health is. It can be affected by so many things around our society.
Thank you, Dr. Hassan. Now, yeah, that's right. It is very important. It's a good time to do this. And again, we are really, so hopefully people who missed this program, they can see on our pharmacy Facebook page, Woodbridge Road Pharmacy, and also that would be uploaded in YouTube, your health and your motivation. So this is very good. Thank you. And now I'll move to James. James, he's as well the trainee in Woodbridge Road Pharmacy, who had a very good experience in psychology as well. Now, James, as Dr. Hassan said, the pandemic, all this issue is going around at the moment. So from your experience, did you come across any sort of problem you think people do need some help from the pharmacy and also from the doctors at the moment? I know doctors are already dealing with it. Lots about we can see from the prescription come to our pharmacy and we see it's look like one every fourth prescription is coming for mental health, some sort of mental health issue. So James, is you just if you have any experience and anything you went through, please. Thank you.
There does seem to be an increasing amount of prescriptions for mental health issues. While currently, this was even before COVID started. Currently, obviously, COVID is affecting everyone differently. A lot of people, as Dr. Hassan said, a lot of people are going to be anxious about it, and it's incredibly understandable. And that doesn't necessarily mean that they have term mental illness. But that also doesn't mean that it's not something that should be sought help. Understanding when to get help it's a difficult thing, but generally, if you feel that it's really impacting your life, that's when you should be attempting to find help.
Now, I'll go back to Dr. Hassan. Now, the current situation in pandemic. Now, many people, they may not have any mental health issue before. So many people really, they wouldn't know when they need to go back to see the doctor. So at what point would you think people should be going to the doctor and just get some help from the doctors? Thank you.
Thank you. First of all, what I would say, it is very important to look after our mental health, and it is also very important to recognize the issues that can affect our health. And when we feel that we are struggling with our thoughts and how we are coping, how we are behaving, and we feel that something is not right with us, or something that we don't feel that we are getting enough help from around us. So I would say that we first need to talk about the people in our family, our friends. We really need to open up ourselves, people who we trust. We have to address that. And even sometimes people who struggle at workplace, we should always address and relay this information to our employers also. And then if we don't feel that support is enough, like if I get enough support from my friends and family, but I still feel I'm not quite right, I'm still feeling quite fragile, I'm still feeling quite vulnerable, or I'm feeling I just need some more help, I just need something different that I don't know what is it. So that's very important. That's very important for us to address. And I think this is the point we should speak with our doctor. And the other thing is also, I want to reinforce, it doesn't necessarily mean we have to go to tipping point to go to see our doctor. If we feel something is not right, we can still have a chat, and we just need to find out what the help and the services are available for us, which doesn't necessarily mean a medication, which doesn't necessarily mean just seeing a doctor. There are lots of other helps and supports are available, so we may not be aware of it, so we can always have a chat with our doctor for that.
Thank you, Dr. Hassan. Now, as you said, yes, we better to go and see the doctor. Now, some people, they may not know the symptoms of really at what point we need to go. So, could you tell us just a few of the symptoms we should be pick up? It could be myself, or it could be our family members who should pick up. Yeah, you may having some sort of mental issues, which I may not be able to pick up. So do you think, is there any family members or any working people where they're working, they should be help each other? And at what point they think, yes, they need to see the doctor about it? I mean, it's similar question to you, the second one, but I'm just looking for some particular symptoms. We may think, yeah, we may have some issue about it.
In terms of symptoms, it is quite difficult to give actually any particular answer, I'd say, because every person actually display different kind of symptoms. But as for example, if you want to talk about depression, most commonly how we address that, there must be some element of depression in ourselves. If you want to talk about that, I would say that if I'm feeling really low, and if I'm not finding any interest in the things that I used to enjoy previously, and if I don't feel that the companies I am having, that's not actually helping me much, or sometimes people actually lack sleep, they cannot focus on their work, and if that thing actually becomes a chronic issue, so it's not like 1 or 2 days, sometimes for 1 day or 2 days, we might feel a little bit different, little bit low in mood, if things are happening in our life. But if that becomes a constant thing, and no matter how much we try, no matter how much we are talking to friends and family, we cannot address that. So those are the things like we consider as probably there is some element of depression in it, and we must need some more help about it. And the other thing is, if you want to talk about like anxiety, which is nowadays we're seeing a lot of patients, a lot of people are coming about anxiety. So we can say in terms of anxiety, we can see at the same thing, if we are getting really anxious, really stressed about very small things, which actually previously was not an issue for us, we could have dealt with it very easily. And now we are struggling with it, and we are finding it very, very difficult to cope with it. And we are reacting very badly on things that we previously haven't. So anything really which we know ourselves, we know our personality, we know how we behave in certain environment. But if we see we're not doing the exact same thing, we're doing something different, and we have that insight that this is not right. So those are the things in terms of anxiety as well. And I think anxiety also actually affects our work-life balance and also our sleep. We might sometimes feel really tired, really fatigued. So there are few elements in our symptoms that I say that why don't we chat with our doctors and what's going on? Is there anything which is not right, which we need more help about?
That's very good. Thank you, Dr. Hassan. So, people which around, we believe as well from the pharmacy, we should be helping each other, because in this pandemic, some young people are there having problem with mental illness. So, I think family members and also people as a colleague, we should be helping each other and to pick up. We can talk to the person in private and say, yes, something you may not have, we think is right. So you do think it's better for you to go and see the doctor. Now, James, I'll come back to you now, since you are working in the pharmacy at the moment. Now, what do you think as a pharmacy staff? I mean, you'll be pharmacist very soon, and also you did psychology as well. So you have very good experience within your education. Now, what do you think as a pharmacist or pharmacy staff can help at the moment within our society where people having mental issue? Do you think the pharmacy staff has any role at all?
Of course, we have a role within helping for, patients with mental health issues. In terms of what extra we could do, I know that within some GP surgeries, they have social prescribers, which are people that would kind of link you to other groups that may help with whatever you may be suffering from. For example, with depression, they may link you to group therapies or certain exercise groups, which are aimed at helping alleviate some of the symptoms. I feel that if we in the pharmacy field were better, well, not necessarily better trained, just more aware of such groups in your local area, we would be able to essentially help a bit more. In terms of what we do currently do, it's mainly giving advice on the medication, and medication isn't always going to be it's not, while for some people taking it long term is definitely the best choice for them, others, they would like to stop and start it, in which case there would definitely be opportunity to intervene there.
So do you mean, yes, Dr. Hassan may tell more about it. So along with the medicine, or before you start the medicine, where counseling might be a little better in early stage. So now I'll go back to Dr. Hassan about Dr. Hassan. I know when someone comes to your setting practice, so where you do the assessment about mental health. Now, is it the medicine, do you think, is the first option to start with, or should they go back to somewhere else, or even within the family, or you just give it time, let's come back with some after some time while you there just to do something else which might help before you start the medicine? Thank you.
Thank you. First of all, the management or the stuffs, the supports that we offer our patients, they are kind of individualized. So as you can understand, we assess every patient and we can take it from there. It depends on so many factors. It depends on the patient's personal circumstances, the patient's choices. The decision making process is always shared. So we share with each other and then we make a plan how that can actually maximize the best support for the patient. So for some patients, it could be a mixture of both, the support, the counseling, the well-being support. We have there's many charity organizations who work for it, to talk to them, to chat to them, and in combination with medication as well. So it actually depends on how the patient is just at the moment and how he or she wants to be helped and feel supported. And the other thing is, usually we have guidance. Of course, we follow the national guidance we have for any mental health issues and any illness, really. So from that point of view, we always offer patients some normal support, like I said, just well-being support. Sometimes if you are someone who is just feeling really stressed, you're just feeling stressed, you're anxious for whatever going through in your life just at the moment, and no other significant problems or issues, we always tend to try some non-medical methods, just like yoga and exercise, and meditation, and well-being, like self-help support group. We have online access to them, so lots of other things to begin with. So it's not actually straightforward going to medication. It comes quite a bit of late, but of course there are some other patients who has significant other issues that we can understand that they also actually need a combination of medication to support. So we offer them that. So as I said at the beginning, it is always individualized, but ideally we would recommend someone who is not actually really a risk to her own self, to access those helps like meditation and yoga. Try all those non-medical methods first to see how that helps.
Thank you very much. That's very good. So as you guys heard about it, really the medicine is one of these options. So I think as a family members or as a colleague, as a friend, we can do much more for our colleague or friend or the family member. So recently the evidences came after this pandemic started. We have more than 500,000 more people suffering with mental health, and it's just going through much more in the young generation. Now, Dr. Hasan, for the young generation, so do you think is there anything behind their affecting much more than the rest of the population?
Sorry, I didn't understand. Can you repeat it?
I mean, recently due to the pandemic, we have more young people are suffering with this very hard time, and also they're suffering with mental health problem. So could you tell us any idea why it's happening, hitting the young generation at the moment? Is it just only the pandemic or something else relevant to it?
I think there are many factors relevant to it. Of course, the first thing, the pandemic has changed in our lives in so many ways. The young people, many of them are not going to school. They're not meeting their friends. They're not getting together like, the football session they do after school. So all the sessions, all those play sessions, at the interactive sessions with teachers. So those are the things that they are missing out for quite a few months, and it is very hard for them. And when they're at home as well, you can see many of them probably have lost family member, relatives because of the COVID-19, or many other reasons. And also probably there's some stressful situation going on at the home. Many parents, they lost job. So the loss of financial things affected the family. So there are many factors if you look into it, because of the pandemic, and maybe not even for the pandemic, but because of the things that evolved over the last few months. So that has affected their life, certainly, because they are going through a quite vulnerable age at the moment. And we probably try to understand a lot of things in context, which is quite difficult for them. So those are the things I think is affecting the young people. Of course, rest of the population are also quite affected. I think you and I, we are also very not very used to what has happened or happening, what is going to be like in future, in next few months, and this same stress actually is affecting more our younger generation and little children.
Thank you. That's very good. We believe exactly same way. Now, James, now recently, I mean, due to the pandemic and the mental health is hitting everybody. Now, the government is planning, they will do some session in a school or the college. Now, what do you think personally? Will it affect, will it help the generation from their early stage?
I don't think it's just younger people that require more education on mental health. I think across the board, more education on mental health would definitely benefit everyone. Recently, mental health is being pushed more to the forefront within news, with characters such as people like, I think it was Prince Harry discussing it relatively openly. The most important thing is the open discussion of it. It makes it a lot easier to deal with. Education to younger children will enable them to deal with it better later in life. But I do also feel that people that are no longer in school are going to miss out on this.
That's right. Thank you. Now, just to go back to Dr. Hassan, we got some question about as well. Now, with the medication, when you prescribe any sort of medicine to any patient, would you take all these their medical condition and also whether it's suitability for them? So how you cascade your prescribing platform for mental health illness for any ages of our population?
Okay, I think what I understood from your question is if we take all the factors from the patient, like all the necessary factors and elements in their life to start with the medication, if I understood right, I think yes, of course, as I mentioned earlier, it is individualized. It is different for each and every person who comes across for seeking mental health support. It's never same for one and the other. And then it takes lots. We definitely need to take account of what are the other medical conditions the patient may be suffering with, and if the patient's tolerability, family circumstances, social circumstances, if they're going to be able to maintain with that medication. So yes, and just like in terms of the pharmacy, how and in medical practice, the things that we do, we make sure this is a safe medication for the patient, and then we do it. And also we do, of course, certain follow-ups on it. We follow the national guidance in terms of the follow-up, as well as we take into account of the patient's circumstances. If someone needs a little bit more follow-up, a little bit more engagement, we do that accordingly.
Thank you, Dr. Hassan. Now, very relevant question to James as well. When we get the prescription in the pharmacy, I know a doctor will write a certain antidepressant medicine, for example, fluoxetine or citalopram. Now, when the prescription comes to the pharmacy, James, as a pharmacist, I mean, now you are not yet, but when you are, and do you think how the role we can play to reduce the, harmness to the patient or to their family members? Do you think as a pharmacist, do we have the role in the community?
From what Dr. Hassan just said, that there are follow-ups done through the doctors. There are certain medications which pharmacists will also do similar follow-ups just to check side effects and things like this, just to make sure they are absolutely okay with it. Some patients are slightly intimidated by doctors. It's just because of the status. nothing to do with how a doctor is interacting with the patient. It's just a little bit scary, I guess. So this is why we also double check such things. I feel like putting in a service like this for antidepressants or any other mental health medications it could be beneficial.
Thank you. Thank you, James. Now, Dr. Hassan, I just go back with one previous question. One of these people asked this question. Now, you mentioned about the yoga, okay? And also there are some other non-medical treatment at the moment people are using. So now, how beneficial do you think the cognitive behavior therapy or the yoga does help a patient who's suffering with depression or any sort of mental health problem, where the sleeping disorder or any other issue? Do you think is the CBT is somehow is getting better over the medicine?
Thank you. First of all, of course, CBT and yoga, they are completely different things. Yoga, you can just find out in the locality. You can join a group, and you can join with friends and family of similar mind. So you can carry on yoga from there. But CBT is a different thing. CBT has been done by the mental health experts from the mental health team in the community. And also it is also tailored towards an individual's mental health condition. And of course, it is part of a combination of treatment. So for some patients, cognitive behavior therapy, it is very helpful. They sometimes don't tolerate the medication, but they find CBT is very, very beneficial for them, and they get more sessions of it. While some other patients, they sometimes feel CBT hasn't helped them at all, so they just want to carry on with medication. So it is also quite different from person to person. So it is quite hard to comment on actually if this is more beneficial than the other, because and some patients, they're actually on both. They find that combination of CBT and medication that helps them. And yoga and meditation, they are really, there is no harm to try them anyway, on top of anything, on top if you're on medication. If you're taking CBT sessions from mental health experts, it is still absolutely fine to work on those sessions like yoga and meditation, and even some exercise, and even some tasks, some works that need lots of focus and motivation and concentration, so that also helps.
Thank you. Thank you, Dr. Hassan. Now, I mean, CBT and all others, we have evidence that they're working for in some respect. Now, also, I knew you did have a little talk on gardening with, now, just, I know you like gardening. Do you think the gardening is would be one of those as well, help us where help with our even sleeping problem or any depression, any sort of thing? So do you think it has some role on us?
Absolutely. As I just mentioned, like exercise or activities that actually involve lots of focus and motivation and concentration. And gardening certainly fits all of these criteria, because it is helping you to exercise in certain way. If you do it really in the right way, if you are working on upper part of your body, you are working on lower part of your body when you're gardening, and you're giving certain amount of routine time every day to that. So that is helping you on focus and concentration, and is actually taking away some of the stresses that we probably were thinking in the back of our mind. So it fits all of these things, and certainly it is something now good at the moment, especially when we are not able to meet many people. We're not going outside that much, so in many ways we're quite restricted. So gardening is something we have in our home. We probably have a little bit of small area or a bigger area, so we can work on a lot of things. We can show our creativity as well. So yes, certainly it fits a lot of the things that can boost up our mental health and actually keep us healthy in both ways, mental and physical.
And I think also socially as well, because if you do gardening, if you visit there, your kids might be there, your partner might be there. So it's helping with the socializing as well. So
Yes.
I think I do believe as well. Now, I know it's nearly half an hour gone, and we have a bit technical issue with setting this program in time. So we do apologize about it, and everyone who's watching, and also some people will be missing due to the time. But I will be on our Facebook page and also on YouTube, Your Health and Motivation. So please, you see, and any comment you have, you put it on. We'll try to discuss in our next program. Now, I go back to Dr. Hassan again to you, but just that would be a last question. Could you just generalize to all of us in this pandemic, in this situation, where we can help more about our mental health issue, improve our immunity, because mental health has very, very effect on our immunity. So immunity, I think, is within one of four criteria at the moment to stay healthy, boost your immunity. Now, could you just generalize your advice to all of us where we take the notes from you? Thank you.
Sure, thank you. Firstly, I would like to say that it's not only our mental health, but also our physical health. It's a combination of our mental and physical aspects that we need to look after. And it's not only during the pandemic as well. All the things that we say, we suggest, and we discuss is for all the time. And mental health is something that we kind of need to address, and we have to reinforce that there are supports available, and there are options available that we can offer you. So there is no need to kind of suffer alone, the suffer in distress. And although we see, yes, lots of patients, they approach us, but still we hear lots of stories. We hear lots of things that many people still they do suffer alone. So I would suggest, and I would actually encourage the people that if you are not sure, even if you're not even sure that what's going on with me, if everything is all right, I think that is the point also, that you seek help. It doesn't matter you seek help from whom. You can seek help from a healthcare professional, or you can actually seek help from all the charity organizations we have, the support network we have in our community. So I would encourage people to do that. And the other thing that you mentioned about immunity, it is again, of course, we have to look after our mental and physical health both, and we have to kind of do exercise and meditation. I think yoga, I keep saying them again and again because they're just so useful. And not only gardening, but also exercise, any certain kind of exercise, to make sure that we are kind of maintaining our weight, we are maintaining a healthy diet, and we are sleeping okay, and we are looking after our mental health. We are trying to enjoy the things that we do. So I think if we kind of manage to look after our overall health, that will actually boost our immunity. And for the immunity, I will also reinforce that a healthy diet is very, very important, because we always feel very, very concerned about weight gain. And also that also actually affects people in terms of the mental health, because someone is feeling that I have gained some weight, I should not eat much. So there's lots of things that then can direct to mental health, like eating disorder even. So I recommend that we try to track our mental and physical health both, and we try to maintain them both in a balance. We try to look after ourselves. That's all.
Thank you, Dr. Hassan. Now, for the mental health, Woodbridge Road Pharmacy in Ipswich also decided to keep our phone line open between 3 and 4 Monday and Friday to answer to your questions. So if you have any problem with the mental health, because we know we had already lots of phone call coming to the pharmacy, even people cried over the phone, they don't have anybody to talk to, but we are there, we have a staff to trained as well to answer to your question. But from the pharmacy, we won't be able to prescribe any medicine, but we can refer you where you need to go. As Dr. Hasan mentioned earlier on, it's not only the medicine, it's not only about the doctor can help, it's lots of things around. You got like the session for the yoga, the non-medicinal CBT as well. You can see them privately as well. So from the pharmacy, we try to help, at least we can talk to you, we can advise you what you need. So if you are really lonely, if you lost somebody due to the pandemic or any other problem, please ring to the pharmacy number is 01473-286-203, and someone will answer to your question. Is only Monday and Friday between 3 and 4. So you are not alone there. We are there to help. And again, we do apologize for the delay due to the technical issue of setting this program. And we really appreciate Dr. Hasan, her time. She gives some good time for us and for you guys. And also James, you are brilliant. You're very good. You'll be pharmacist. I hope you'll take this message from Dr. Hasan as well. Really, it's not only the doctor who can just help the mental health. It's the pharmacy there also will be helping. So good luck for you, James. And in the next program, we'll be focusing on children mental health, because we did see the rise of the children mental health, and NHS has the agenda how to deal with the mental health. And we have evidence that 1 in 4 people in this country has some sort of mental problem. So it's not only the medicine can help, it's counseling, it's CBT, it's yoga, it's lots of things there. So I hope you get some good information from Dr. Hasan and also James. So please apply it. If you have any question, come back to us. We'll try to answer you. You can either ring us or you can put it in the message to our pharmacy Facebook page. We'll try to answer to you. And if we cannot answer to the question, we'll pass on to Dr. Hasan or any relevant people who can answer to you. So we are there. Again, we would say you are not alone there, because we need help each other in this pandemic and in this situation where you need socializing, you need friends. So we are there. So again, Dr. Hasan and James, have a good evening, and we'll leave you there. Good night.